Hi, Ms. Romero. My name is Katrina. I am the emergency room nurse here, and I see that you're quite fatigued. Can you tell me more about why you're here in the emergency room?
I've just been having some trouble breathing. I can't fully take deep breath. It really hurts, and I've been having some fever and some chills at night. I lost a couple pounds, but I haven't been eating either, so I don't know. That's why I'm here.
Okay. Well, did you have anything else that you wanted to share, such as family history? Are you aware, or even previous histories of diagnosis that you were?
I have problems with my kidneys.
Oh, okay. So
I'm not on dialysis or anything. I've always had problems with kidneys since I was a kid.
Okay, usually we wouldn't offer dialysis to patients unless it's like complete kidney failure. So do you have an idea or recall about what stage you're on?
I think stage 2, I believe. Last time I checked.
Okay, so Dr. Gupta is gonna come see you after I just check your vitals as well as assess you, since you are complaining that it's mostly in your when you breathe, right?
Right.
So I'm gonna focus more on your lungs. So let me first take your vitals. Can you please put this? And then I'll place this under your arm. Can I please have your... Thank you. And then... That. So I see that your oxygen levels is pretty low. You're at a 90% for your oxygen levels. And your pulse seems to be at a 96, and your blood pressure was 167/72. Okay, so I'll let the doctor know about that because they are kind of high range, and your temperature came back as 99.6. So I'm going to now assess your lungs. And are you able to tolerate sitting up? Because I know that you feel like you're having difficulties breathing, right?
Yeah, I don't like laying flat because when I sleep, I need to be sleeping like this.
So how many pillows do you usually sleep with?
Two on my back.
Okay, alrighty. So I'm just gonna listen to your lungs, and we'll make sure not to work you too much because I understand you do have to take your breaths. Can you please take a deep breath in? Okay, out. Take a deep breath in. Out. Take a deep breath in. 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 Okay, I'm going to check on the other side. Take a deep breath. Take a deep breath. Take a deep breath in. Take a deep breath in. Okay. So I understand that sometimes when you're positioned in a certain way, you have difficulties breathing. Do you mind me listening to your back, or do you want...
We can try.
You could try? Okay. Okay, so let me just...
Oh, I can't.
Okay, so I don't want to push you any further.
It hurts
So,
too much.
so let's go have you rest for a while I tell the doctor about your results, your vital signs, as well as what I heard in your lungs. And if you need anything, just use your call light, okay? Hi, my name is Katrina. I'm the ER nurse. I have a patient here that's being transferred up here to the step-down unit. This is Fabiola Romero. She was admitted last night. She is a 24-year-old female with no known allergies. She is 5'6" and 170 pounds. Her doctor is Dr. Gupta in Team 7.
Okay.
Her code status is full, and her diet is 2 grams sodium restriction, so regular cardiac diet.
Okay.
She has no isolations, and she does have Accucheck's ACHS.
Okay.
Okay?
She's diabetic?
Yes.
Okay.
So she was she came in last night with a chief complaint of night sweats, a little bit of fevers, chills, shortness of breath. And when I was trying to do the respiratory assessment on her, she couldn't tolerate when I put elevator at a 90-degree angle.
Okay.
She was complaining that she had pain. So that's what brought her to the ER last night.
Okay.
She had an x-ray done because the doctor came in to see her and did order that, and it did confirm that there was pleural effusion.
Okay.
So the doctor did order another procedure of a CT scan, but that's still pending. So if that does confirm, you know,
So
fluid
it's
overload,
not done yet?
it's going to be done later on today.
Okay.
But just, you know, keep up with it.
Okay.
She has a history of stage 3 kidney failure,
Okay.
as well as diabetes type 2,
Okay.
as well as cigarette and alcohol use.
Okay.
She doesn't have any IV fluids running, and her medications are furosemide Lasix,
Mm-hmm.
and the doctor did order fluid restriction just to stop the fluid overload.
Okay.
Her vitals were 99.6 Fahrenheit. She has increased respiratory rate. It was probably about 28
Okay.
when I assessed her last, and her heart rate was 96. And she is currently on 2 liters of oxygen.
Mm-hmm.
And RT also comes here to do breathing treatment because she does have shortness of breath.
Okay.
She sats at 96 for when she's on 2 liters, but if she's just on room air, it's about 80. So
Okay.
just keep that running. Last Accucheck was 150,
Okay.
and she does complain of pain 7 out of 10, like a pinching feeling.
Did she get anything for pain?
Last time I medicated her was 2 milligrams of morphine IV, and she does have an IV line on her left AC. It's a 20 gauge.
Okay.
So she's able to take oral intake. So just know that she could do that. Also, the doctor wanted to keep us to monitor a strict INO just to see how much she's taking in. But again, she's on that fluid restriction.
Mm-hmm.
So when I performed my physical assessment, she did have skin dry intact. She as well as alert oriented ×4, negative negative for Babinski, features are symmetrical, eyes are reactive, as well as she's able to perform pedal pushes. She doesn't have any, you know, headaches or anything like that. Cardiovascular, it's actually, sometimes it would be normal sinus rhythm, and then it would be tachy.
Okay. She's on the monitor?
Yeah, she's on the monitor.
Okay.
So just, you know, just keep tabs on that, as well as heart tones are S3. She does have jugular vein distension. Mucous membrane is pink and moist.
Mm-hmm.
Capri-fill is fine. Homan sign is negative. Her pedal and radial pulses were very bounding,
Okay.
as well as lung sounds. I heard diminished bilateral lower lobes, as well as she does have a cough, and she will complain that when she coughs, because of the when she inhales,
Mhm.
it hurts a lot.
Okay.
So that's why I medicated her earlier with the morphine. Symmetrical expansion is equal, so she does have that complaint, you know, shortness of breath and pain when she inhales.
Mhm.
So the abdomen is fine. Bowel sounds are normal active. Last BM was prior to being admitted to the hospital. She doesn't have any nausea, vomiting, diarrhea, constipation, or any pain in regards to the GI. She urinates fine, but it's been a little bit down since we had to, you know, limit her restrictions, and she's not on any IV fluids.
She uses
In regards to her musculoskeletal,
Mhm.
she's able to ambulate, but the thing is that after, you know, a few minutes, she does complain of shortness of breath, and then when you turn her, just be really gentle with her because she does complain that it's most of the pain is right here, like where her diaphragm area is. So just be careful turning her, as well as, you know, maybe have someone walk with her to the bathroom just in case she doesn't fall, because she is fall risk. So is there any more questions?
That's it.
Okay, alrighty, nice meeting you.
You too. Thank you.